Once I say the word disability, probably many of us will start thinking about someone using a wheelchair, crutches, or any other mobility devices. But not all disabilities are visible or obvious. In fact, most of the disabilities are non-apparent. Amongst many other difficulties and stereotyping, people with non-visible disabilities are often questioned about the legitimacy of their disability, adding more weight to their existing challenges. To deepen our understanding on non-visible disabilities, we have the pleasure to welcome Mrs. Nadjah Abbasakoor, an advocate of nearly 20 years for inclusivity and also the founder of Inclusion Station Mauritius. Hi Nadjah.
Hi Krishna.
Thank you very much for accepting our invitation.
My pleasure. Thank you for your initiative.
And we'll be grateful to have your valuable experience, to share those experience about non-visible disabilities and also your journey as a professional. So Nadjah, please tell us a little bit about yourself and your journey as a professional in this particular field.
So Krishna, I'm a speech and language therapist and I graduated in 2005. My professional journey started in London when I worked for a few years for the National Health Service. Since my return to Mauritius, I've been working privately mostly. And in 2022, I founded the Inclusion Station, which is a multidisciplinary practice, and we aim to support children with needs and their families. We also represent in the region, in the Indian Ocean, the Hidden Disabilities Sunflower Program. And since recently, we have founded a foundation which is working tirelessly to promote inclusion and raise awareness of those conditions in the community.
That's part of the Sunflower Project?
That's part of the Sunflower Project.
So if you can explain to us a little bit, because I've heard a lot about it and you're doing a wonderful job. I can see that on the media. Please tell us a little bit about this amazing project which is known as the Sunflower Project. Am I right saying that?
Yes, so it's called the Hidden Disabilities Sunflower, and it originates from the UK. It's present in many countries around the world, so in the North Americas, in Brazil, all over Europe, in Dubai and the UAE, so mostly Dubai and Abu Dhabi, Australia, New Zealand, and since last year it's present in Mauritius and Seychelles through us, through the Inclusion Station. The idea behind it it's a very wonderful idea, is that the person who has a non-visible disability wears the symbol of the sunflower to indicate that they have a condition that is not visible.
And that, sorry to interrupt you, that symbol would be in the form of?
So that symbol can be in the form of a lanyard, a card,
a badge,
pin, yes, a bracelet, a t-shirt, a cap. There's a lot of merchandise that's been developed by Hidden Disabilities UK for these people to purchase.
I have a question when we talk about having lanyards, pins, or a bracelet. Are we not kind of stigmatizing, for example, if I'm using the right word, because then people will know that this person has a particular disability. Mm-hmm. So how do we overcome that challenge?
Well, the sunflower is non-specific. So when you wear the sunflower, you're not indicating which disability you have. The program currently recognizes 910 disabilities across different areas. So the area of mental health, the area of neurodevelopmental disorders such as autism or ADHD, progressive disorders like Parkinson's or Alzheimer's. It's all included under the hat.
So maybe this artifact, if we put it this way, is moving from an aspect of stigmatization to helping these people and to become more compassionate towards them?
Yes, I think the aim is really for when a member of the public sees a person wearing the sunflower, is that they get an understanding that this person may need a little bit of help, a little bit of time, a little bit of repetition, and I think it indicates to the person opposite that there's no need to judge if you see that something is not going quite right.
And how is the implementation going right now? Because you just started, you said to me, it's been how many?
It's been a year now that we launched it in Mauritius and the Seychelles, and it's going okay. It's going okay. We've got a couple of companies who are already members of the scheme. We've got quite a few sunflower wearers now.
Okay.
And as I said, the foundation is now working on promoting the symbol as a symbol of hope for the people who have non-visible disabilities.
And those companies, are they accommodating these people with non-visible disabilities?
They are. So as part of their workforce, they are hiring, accommodating people who have non-visible disabilities.
And that's only within a year, so hopefully in the coming years we can see more people.
Yes, I hope we can see very positive changes coming very soon.
I'm pretty sure. Yeah, I'm pretty sure. Okay, Nadjah, if you can share some more philosophies about the hidden disabilities through the Sunflower project, that would be nice. But else I can move on to the next question.
Yes, yeah, please do.
So when we talk about non-visible disabilities, what are the common misconceptions that people have about this particular condition?
So overall, because the condition is not visible and there are no signs really that a person has one of those conditions, you know, for people, if you can't see it, it doesn't exist.
It doesn't exist.
It doesn't exist. So I think that's the main thing. And how the sunflower supports it is that it indicates that it is here. There is something that exists. So I think that's the most common misconception. And from when you hear people's stories is, you know, they often get comments about how, oh really, are you sure? Because it could just be laziness, or it could just be lack of motivation, or, you know, maybe you're just not interested to do it, so you're not able to do it. So, you know, there's a lot of judgment associated.
So people think you're able, but you're not willing to do it.
Yes, okay. I think it's been quite recurrent.
Talking about this misconception, a question just popped up in my mind, if you allow me to ask that. What about children? How do children cope with that? Because let's say we talk about the Sunflower project, how the lanyards, how the pins, but okay, for maybe adults, it might be, they might have a better coping mechanism. But at school, if the child is wearing this, what's your views on that?
So far, we have more children than adults wearing the sunflower.
Okay.
Overall, globally, it's more children than adults. I think if they grow with it and they grow with the idea that it's okay for me to wear my lanyard, and I think, you know, also charity will start at home and at school, so the other children of the class and of the school will be growing up with children who have non-visible disabilities.
And also maybe it might reduce some form of bullying that was there before wearing the lanyard, the pin or the bracelet.
Yeah,
so
absolutely, and I think the more those children are included in a classroom and the more it becomes part of the DNA of the school and of the community to accommodate and include people who are not as the same as us.
Yeah, so. Excellent, excellent. And how would you define non-visible disabilities? We've been talking about that now. Let's see, how do we define?
So a non-visible condition it's a condition that obviously you can't see. So there will not be anything like a cane or a wheelchair or a hearing aid or any form of aid to show that this person is needing support. But it is still a condition that will impact a person's ability to function, to learn, maybe even to move, to sleep, etc. So it is a condition that is not visible to the person opposite, but who will be impacting the person's life significantly at times. Yes.
But now that you've defined non-visible disabilities, what about the perception in Mauritius? Are we more aware of that, or do you think we're still at an infant stage, or how is it going?
I think we're certainly more aware in the past couple of years of it. which is great. The awareness is growing, but there's still a lot of work to do.
Still a lot of work.
There's still a lot of work to do.
I wish you all the best.
Thank you.
Okay.
Thank you.
And why do you think such disabilities are often overlooked and misunderstood?
Well, again, I think it's because they're non-visible, and for some people, as we said, when you can't see it, it doesn't exist.
Does it exist?
Yes.
Yeah.
And so it's overlooked. The person looks absolutely fine, but on the inside they're probably not fine. And the more you overlook it and the more you dismiss the person and their profile and their abilities and their difficulties, the more that person's going to be affected.
Okay.
It will take a mental and emotional toll as well.
Definitely, you have to be quite strong. And now there's another thing that when you're talking, when we give someone, let's say, a lanyard for them to tell to the society that I have a disability that is not visible, but wearing this artifact, if I put it the right way, this artifact, does the person accept it himself or herself first, that the person that has a disability, or they're a bit reluctant to wear this?
It's a choice. The person makes the choice to wear it or not.
Okay.
And what I find very interesting with it is, if for instance you take the example of a person who is bipolar, they may be fine on a Monday and choose not to wear it on the Monday, but they may feel like they need to wear it on the Friday. So I think this is what I like about the sunflower, is the flexibility.
Okay.
But it remains the person's choice. To wear it.
Yeah. And I think, like you said, something very interesting. It's the person's choice. Maybe, let's say, in a week, the person did wear it 3 times. Maybe it's already creating awareness that even if next time the person is not wearing it, the society, maybe the person in the environment would know that this person has a non-visible disability.
Absolutely.
Okay.
Yeah. It's a way of disclosing without having to explain.
Okay. Yeah.
What's happening.
Yeah. Not to justify.
You don't need to justify anything, but you are just showing that there is something going on with me. Please be patient.
Please be patient.
Please be kind.
Yeah, definitely. And can you share some conditions which are considered as non-visible disabilities?
So, as I said, the Hidden Disabilities Sunflower recognizes 910 conditions, and those conditions are split into different categories. So all the neurological side of things, so Parkinson's, Alzheimer's, the progressive illnesses, stroke. A stroke can be a non-visible disability. Any specific learning disabilities like dyslexia or dyscalculia also form part of it. And obviously the neurodevelopmental conditions like autism, ADHD. You also have certain conditions like Tourette syndrome, Crohn's disease. There's also an emphasis on female health, which I think is quite important to consider. So premenopause, menopause, endometriosis are conditions that are non-visible, but they do affect a person.
And I don't know if you've mentioned that I was trying to keep track, and maybe also mental health related challenges.
Absolutely. So mental health is a very big category. And it covers a whole range of conditions, and most definitely, yes, conditions like bipolar disorder, depression, which are now on the rise as well in the past few years. Yeah. So the sunflower does cover for all of that. Yeah.
You mentioned, if I got it right, 900 non-visible disabilities that are under the sunflower project. Mm-hmm. But are we adding more to that?
So every year there are more conditions that are added. Yes.
Okay.
So how it works is that so in the UK they're very fortunate. They have charities and foundations that regroup people with a condition, and those charities will go to the Hidden Disabilities team and advocate to have their condition be recognized by the symbol, so that their patients and users can be using the symbol too. So in the UK, this is how it happens.
Okay.
And but again, they're very fortunate to have a charity for each condition over there, And then the work is the awareness work is taken globally. So when you're a member of the Sunflower program, you have access to podcasts and webinars, which are specific to all of those 910 conditions.
And that's been sent to you?
That is sent to you via email, the invitation. So there's usually about one podcast a month.
Yes. I do follow a lot of your emails as well, because it's quite informative about non-visible disabilities.
Yes. So in Mauritius, we have a newsletter which goes out every Wednesday. That's our work here for Mauritius. And so I'm glad you're enjoying them. And if there's anyone who wants to join the newsletter, they can just send us a message.
So we can forward that to...
Absolutely, it's open to
the public at large.
And it's really to raise awareness.
Okay.
Yeah, and to support the families who need it.
Interesting. Nadjah, you as an advocate for building an inclusive society, can you tell us how can you progress towards building an inclusive society for people having non-visible disabilities pertaining to education and the workplace, and more importantly, the society at large? So there are three things how we can include people with non-visible disabilities to make them more inclusive.
I think if we're going to start early, the better it is. So to have very young children included in the mainstream classes is very important, not only for them but also for the other children to grow and to accept from a young age. Children do not discriminate.
Okay.
So it's important to have individual education plans put in place for those who need it, and for those children to have access to support in the classroom. Personalized, obviously, depending on their profile of needs. We are also working towards more inclusive workplaces. It's important that business owners and managers understand the different conditions, are aware of them and what they can do. So things like flexi time, they can really support a person with autism or ADHD or a person with mental health conditions, and it's something I believe is quite simple for businesses to put in place to be supportive of their staff. And in the community at large, I mean, it would be ideal if everyone could recognize the symbol, and if they show kindness, they show empathy, they show patience, and they don't judge, and I think that in itself will be a big part of the job done.
Excellent, excellent. Nadjah, maybe my last question for this session is, at your foundation or Inclusion Station Mauritius, do you only welcome children, or is it people of different ages? If you can tell us a little bit about how Inclusion Station work, that would be wonderful.
So no, we do work with people of all ages. So at the Inclusion Station, we're a team of therapists. So myself, I'm a speech therapist. We have occupational therapists. We have learning support teachers, so special needs teachers. We also do social skills groups for children who need the support. And we also work with adults or teens who need the support. We also aim to work with the families.
Okay.
Because it's not always easy to have a child or a person who has a non-visible condition in the family, and the parents, the grandparents, the siblings, sometimes they need to be supported too. So we also aim to support them.
You're contributing, let's say, 20%, and it's the family.
Absolutely,
80%.
It starts at home.
Yeah.
It starts at home, and we're only seeing the children once a week. So the rest of the time, the work needs to be continued.
And if someone needs to contact you, they can visit your Facebook page or your website.
Yes.
So it's Inclusion Station Mauritius.
Yes. So we have two Facebook pages. It's the Inclusion Station, and then we have the Hidden Disabilities Sunflower Mauritius page, which you can follow and contact us there.
Excellent. Nadjah, it was wonderful to have you on today's talk show. And I'm pretty sure you're doing a wonderful job, and keep it up. And hopefully in the coming years, the Sunflower Project would be blooming much like it's been doing for the past 12 months, let's say, because it's been here for 1 year. So all the best, Nadjah.
Thank you. Thank you.
Thank you very much.
Thanks.